good evening. We're going to be going over lifespan and development. We have both of our classes in here tonight, so we're going to make sure that we had to change a little bit so we can turn around and get everything situated so everybody's on. All right, so lifespan and development. Okay, so I read these. I do a little different. I kind of like audiobooks. So the way that I read it, if you're up in your house, you're moving around, you're on shift, you're not constantly having to, oh God, what's he talking about? I'm very kind of dictative, or I guess when it comes to this like that. All right, so some of our lifespan developments, this does apply to our fundamental knowledge of lifespan development as a patient and how we manage our patients as we move forward and going into treating them. So human beings evolve through their lifespans. We understand that we all start in one small baby position, and hopefully throughout life we're able to get older. And we all know that there's a stage of death. You're born, and at the end, there's all the inevitable. We all will pass at a later time. So basics, just to let y'all know, we are going off the advanced slide, so you'll see a lot of the AMT stuff in there. So basically what we want you to do is we want you to be aware of what particular stage goes on in each individual part of the life. Obviously, we know that I'm not going to treat a baby just like I'm going to treat a 19-year-old or even some of our geriatrics. So we have to adapt how our care is done. We have to gather questions from our parents as minors, and then we start phasing into where we start asking our parents. Sorry, everything's ringing over here on my end. So we have to figure out, we start moving into asking the particular patient we have we're dealing with, and then we have to adapt those questions again to the stage of life that they're in. That is not mine. That is not me. I would love to tell you that is me as a baby. It would be a lot better picture. But so our infants are broken down into the ages of 1 month to 1 year. So we always think about when our babies are born, no matter how old they are, we're like, oh, look at my infant. Well, technically, your neonates are from birth to 1 month. So we do all eventually bring home the neonates, and then we all turn around and we have the age of 1 to 1 month. I kind of give you an idea to keep information like this. So jotting that down, taking a snapshot of the screen, it gives you put that in a file in the back of your head to where you have that ability to know, okay, when you write your report, I was patient was an infant, or when you're writing your report, knowing those different ages. So here's a very, very important slide. So vital signs. All right. So the younger our person is, the faster their pulse rate and respirations are just going to be. So you see on your screen at birth, you're going to have anywhere between 90 to 205 beats a minute. All right. So their respiratory rate is going to go anywhere between 30 and 60. So that is normal for a neonate infant. Now, if I check an adult's pulse and their respirations, and they're breathing anywhere like 30 to 60, I'm gonna be like, hey, cuz, you good? Like, let's put some oxygen on you. I need you to take some deep breaths. I need you to slow down some. So we have to think about that when we're dealing with our patients. All right, so within the first half hour of our neonate's birth, you will notice that their heart rate will start to drop anywhere around 120 beats a minute. So you got to think, as they're coming through the birth canal and they exit, and they're under stress. They have some undue, it is due stress, but they do have some undue stress that's added to them as they're being compressed from relaxing inside the womb until they compress until they come out. That's a lot of stress on them. And then when they start breathing on their own, that's new to them. That's new. They got to figure all of that out. So once they realize, oh, okay, I can handle this, you will see that start to drop. By the age of 1 year, the respiratory rate does start to slow down to about 20 to 30 breaths a minute. They're starting to get into that normal range. Their need for oxygen is high at a very young age. So the tidal volume in neonates starts anywhere between 6 to 8 milliliters per kilogram. So I understand basics. That's maybe a little. You're like, oh my God, what's he talking about? So we measure the weight of anybody to kilograms. So if I'm here in my office or if I'm on the streets and I'm trying to give a medication, I have to know what they are per kilogram because my medicine for children is very different from adults, and we issue that into kilograms. All right. So let's talk about their blood pressure. So our blood pressure does start to correspond to the patient's weight. So typically that starts to increase due to age. At the birth, the average systolic blood pressure of a neonate is anywhere between 67 to 84 millimeters of mercury, and that's 60 to 80 over 85 to 104 by the age of 1 year. So a neonate's normal body temperature does start to range anywhere between 98 and 100, while an infant's normal temperature should be 96.8 to 99.6. As you progress through here, remember that if y'all see this right here, that is technically not a temperature anymore. You don't start getting into having a temperature until you get into the 100s. So if you're 99.8, 99.9, yes, I'm pretty sure momentarily they're going to be over that and start having a fever, but that is not considered a fever until it reaches up into the hundreds. All right, so a weight. We know that these infants, they eat a lot, they eat, sleep. That's all they do. So their normal birth weight, and I say normal, but you understand things change in life. So their normal birth rate is anywhere between 6 to 8 pounds, and that is converted to 3 to 3.5 kilograms. Just a simple, quick math, so y'all will be aware on how we do this. So if we're going to turn around and take, let's see if I can put this on the screen. Ooh. So here, so if we're going to say 185-pound person, we're going to divide that by 2.2, and that roughly gives you 84.1 kilograms. I mean, it's not roughly, that is pretty right. So if you're in a field and you're trying to do something fast, let's say this. So let's, for easy math, 200 pounds, that's 100 kilograms. I know it is plus or minus a couple of little pounds. So just to show you, obviously 91 kilograms. I am not that far off, but if I'm in a hurry, I'm just going to divide it in half and call it good. But if I have the ability to, like, okay, I got to make sure this particular medicine's right, you will take their weight divided by 2.2. All right, so see how I ramble? Here's an example. All right, so in the first week after birth, our neonates do start to lose anywhere between 5 to 10% of their birth weight. Now, just because they're getting rid of fluid weight. All right, so by week 2, now our neonates start to grow at a rate of about 1 ounce per day, and then that is doubling their weight by 4 to 6 months and tripling it by the end of their first year of life. Their cardiovascular system, so at birth, the neonates make the transition from fetal to independent circulation. So when they are born or when they're in the womb, obviously the mother is making, they're giving them enough blood for them to have pump, but they will rely back and forth on the mother on the blood valve. So they're now, when they're born, they're transitioning into their own. Once that cord is cut, their heart is moving on their own. They're trying to figure out, just like sometimes we have to figure new things out, like, oh my God, I don't know what I'm doing. You will notice that stress it puts on them, that's what increases their heart rate. So you will notice that they start to transition that. That's where you'll see it start to drop because their body has figured it out, and now they're moving on and going forward. And it's not working. There we go. All right, so their pulmonary system, their lungs. So neonates are 99% of the time going to be nose breathers. You will see that when they're first born, they're mouth breathers because they don't know how to breathe out of their nose. All right, so infants younger than 6 months are then particularly to be have those nasal congestions that will turn around and lead to your upper respiratory infections. Um, so those are your germ holders, and in your home are the infants and children because they go to daycare, they go to uh, whomever may be watching your child, and when they come home, they're gonna be so sick, and you're like, my baby's been so sick its first year of life. Yep, sure are, because they don't have anything built up into their genes that tell them to release this antihistamine or anything like that. So that's where they get super sick. The infant's rib cage is less rigid than an adult, so you get that sponginess. So you see in this picture, oh, the picture's coming up, that they get that sponginess. So they are not hard yet. They're I'll say it this way. So when you have to do with a child or an infant, they are going to be more of a belly breather. You're going to see their chest rise and their belly rise. And when they deflate, you'll see both of them go down. So that's why you see those cute little ones with the big bellies and all that. When they breathe, you're like, whoa, they're full. Yes, but they're having to use all of those muscles again because their body's learning how to do it. When the chest rise, the belly goes in. They deflate, the belly goes out, the chest comes in. They're learning all that. They're using all of their accessory muscles. They're not as their lungs, their ribs. Those muscles are not they're not mature enough, so they do get fatigued very easily. So that's why your infants and neonates use that accessory muscle of their stomach. So an infant has a proportionally large tongue, and it's very shorter. It's a little bit narrow. That is it provides for a less of a stable airway. We have to make sure that their airway stays clear because having that little bit, the little openings, the little tongues, and the gums, things happen to get blocked a whole lot easier than some of your older children. Yeah, I mean, so the way, like when I teach CPR and talking about different sizes, how much you breathe for one versus the other. Imagine, so y'all know the little Coke bottles. I'm talking about the little ones. They're obviously not that little, but the little ones, like the individual ones. I look at that and I kind of lay that out for my CPR classes is these are your lungs. I will take the little bottle. Here's your children. You'll take the bigger ones you buy in the gas station, the 16, 20 ounces. Those are your and those are your adolescents and children. Then you bring out like the 1 liter, that's your juvenile, into your 20s, and then you're developing in your 20s into older into the 2 liter bottle. I'm a visual person. So when I talk about the different size airways, think about that in correlation of it kind of gives you an idea of what the rib size, the lung size are going to be. So you understand why they get so short. So helping me teach that, and everybody wonders, why do I carry bottles of water around for my CPR class? It's because I'm weird. Y'all will learn that more. So when we start to bag bag ventilate our children, for this right here for our basic class, this is a ambu bag or bag valve mask. You will hear them both. Majority of it is now considered, this is all people refer to this as a bag valve mask. My old self still remembers that as being an ambu bag. Same thing, same name. We're talking about the same part. They have to use the appropriate size mask. I'm not going to go and get the adult size and use on this infant. It's just not going to work. It's going to cover their whole face. I'm ventilating them. Yeah, no wonder their eyes are dried out and you're blowing air down the side of their face. That's why. So getting the appropriate mask for the appropriate patient is very beneficial. Remember that an infant's lungs are very fragile, so overventilating them is a bad thing. We want to make sure that the bag that he is squeezing, he is squeezing right here. It is appropriate to the size of the patient that we have. Again, I may have a infant mask, but an adult bag ain't gonna work. So we have the most of your services that I've seen nowadays have age group specific bags, like you have a infant cardiac arrest or a child cardiac arrest. majority of the other ones can start to use those adult ones. We don't have any type of pediatric drugs, ambu bags that fit those. We don't have any of that on the facilities out here in the Gulf of Mexico. We don't have children. It's a very rare occasion. If a boat comes up and they ask for help, we will provide that. But again, we don't have those. You're 160 miles out. It's very rare to see a fishing vessel out here. It's not that we don't see them. It's a 13.5 hour ride by boat from the beach to us. So if you're going deep sea fishing out here, you're gonna be riding a while. So we just don't carry that here. But some of the services, and I've seen some of the local fire departments that I do work with around my area, they have those. So you'll have like all the red bags on the trucks are for the normal ones, all of our regular patients, and we'll grab the blue bag if we get a pediatric call. And a lot of times people will group your pediatrics into uh, adolescents down, but sometimes you have to adjust. I always like to say from the South, sometimes an adolescent might be an adult. So you got to figure out their body size. All right, so on our nervous system. So the nervous system continues all the time to develop after birth. So a neonate is born with a certain types of reflexes. You have your Moro reflex, or the startle reflex is what it's also called. That just happens to be when a neonate is surprised by something or someone. The neonate does open his or her arms wide. They spread their fingers, and it seems to grab things. I was watching a TikTok, and this guy was talking about how they mentally assess some of the children on reflexes that they're trying to see if they're delayed versus they're on task, and they're aging slower. Babies will react like this, where they spread their fingers and they're reaching for things. They'll do that startle effect. The older they get, if a child is pushed backwards and they do that, they do this instead of put their hands down to try to catch themselves. That's part of the neurological checks that some of your pediatric specific physicians are using to assess these children. Sorry, told y'all I get sideways. So the palmar grasp, that happens to occur when the object is placed into a neonate's palm. The rooting reflex takes place when something touches the neonate's cheek. The neonate will instinctively turn his or her head towards the touch. So they're learning what it is. If something is cold, you're going to see them turn too. They don't know to do like we do, is to, like, if we touch something hot, we instantly pull our hands back. Rob, I don't know if you see on ours. Jared's trying to get in. I don't know if you can help that out.
Give me 1 second and I'll try to work on that.
I think they're in another class. So then you have the sucking reflex that happens to occur when the lips of an infant are stroked. I tell you, when I was going through paramedic school, my oldest was a baby, like baby, still in the car seat. When I was going over pediatrics, when I was going over cardiology, I put that baby through everything. I was like, oh, I can do this. And you run your finger down their lips, and because it's instinctively in them when they eat that way. You brush the bottle over their lip, or when the mother breastfeeds, you brush it over their lip, and they start trying to suck because they know that's how you get food coming out of that bottle or their mother. So that is another type of reflex that we use when we're checking their nervous system. All right, so on their skull or their fontanelle, their heads they get molded. So the fontanelles are the surface areas between the bones that eventually fuse. I'm not swapping. They eventually fuse to form the skull. As you can see on the picture right there, you have your anterior fontanelle. This is the soft spot that we talk about on babies. When doctors will hold them and they're grasping them, they run their hands over. Obviously, if you take and push here, you're going to be able to push inside their skull. That will create a lot of damage. That's battery and 99% of the states across the world. So those fontanelle, the soft spots do grow up, they heal, the bones grow just like everything else. So we have to be careful about that. All right, so the 3 or 4 bones of the skull eventually do start to bind and they do start to form some suture joints. The posterior fontanelle normally does fuse by the age of 3 months in children, and the anterior fontanelle fuses about 9 to 18 months of age. So we're talking about the back of their head, which will be like right into here, and then their anterior is going to be on the top. Those are 2 of the biggest soft spots that we check on children. I'm having some serious trouble with my connection, so I think I'm just going to have to watch recording. No problem. Appreciate you letting us know. All right, so if either of those fontanelles are sunken, they're depressed, that's something that we look for in infants that shows us how dehydrated that they are. If you see them, it's hard to check their hydration level. We can look at their gums, but the telltale sign on an infant and a baby is when you're holding them. If you run your hand over, I'm trying to get my hands words. If you run your hand over it, you're going to see that it's sunk in, and you'll feel that there is some depression in their skull. A lot of time it will be front and back. Now, if you see those, they have a bubble there and in the back, that is showing you that they have some intracranial pressure. You may have the shaken baby syndrome or the baby was dropped. Those are your signs that can tell you that. You will see that a lot faster than you will if they have like the battle signs or anything like that. They start forming their eyes from that shaken baby syndrome. Trying to get comfortable. Sorry, I know I move a lot. All right, so the musculoskeletal system. So we know these growth plates are located on either end of the infant's long bones, and they help aid in thickening out those bones for those particular children. So bones grow in thickness by building on themselves. So again, babies, they grow this way when they start growing, and then they also grow this way. Now remember, when we get older, we start to go down in height. We lose some of the density, we lose some of the muscles, and we start to actually start shrinking. I can always remember, because when I was a child, I always remembered how tall my dad and my grandfather was. The older I got, the closer to height we got, and then the older my grandfather got before he passed, he was a lot shorter than I was, and I finally didn't realize what it was until I was going to paramedic school and why that happens, and further in depth of why they actually lose some of their height. So the renal system. So in infants can become dehydrated very, very easy. Their kidneys usually cannot produce enough concentrated urine. So an infant's urine consists mainly of water, which can cause the development of electrolyte imbalance. Out here, we push hydration very, very much. At home, I take that part home, a lot of things home with me, but that's one of the things we do, because I run my own business. I do a pressure washing mobile detailing business. And during the summer, dumb me does not stay hydrated enough. And there's multiple times, it happens every year. I'll go ahead and say it'll happen this year. I'll have to get an IV and start an IV on myself, or somebody will come by and I'll get a bag or two and I'll be back good. What's happened is I'm dehydrated. I can't catch up when I start drinking and realizing things that are happening. So the infants are going to they're going to be dehydrated early. We want to encourage these sick children to drink when they're thirsty. Give them something. It's okay to change the diaper 500 times an hour. That's fine. We want them to stay hydrated. But when they're sick, they don't want that. They don't have the ability to stay hydrated enough. On their immune system, we know for the first 6 months of life, their immune system maintains some of their mother's immunities, but that's the reason why they'll always encourage mothers to breastfeed. Some are just physically unable to. And I know I've seen here recently a lot more that some mothers that overproduce are actually selling that milk for some children that can't have breast milk, because that puts out those antibodies, that puts more into their immune system. So when they have that low immune, the sicker they're gonna be. It's hard for them to build that because they didn't have it. They come out at 0. We got to get to 100. So we got to build those immunities in them one way or another. So infants can receive some antibodies breastfeeding, like I said, and again, that does help bolster up their immune system and helps them stay a little bit more healthy. They're still going to get sick, but it will build some more of the immune system. I know everybody's hot topic and favorite thing that happened recently. We'll talk about COVID. My sister-in-law actually was pregnant during COVID. She was sedated. They delivered her baby, put her in ICU on a vent. So she was unable to breastfeed for a little while, but she was super sick with COVID. They would not allow her to breastfeed in the hospital because we at the time didn't know a whole lot about it. But they do encourage to breastfeed more and more. The kid's already in the immune system. It's going to get some of that immunities. I'm a huge proponent for breastfeeding when it comes time for infants, but for children, because it just helps them get a lot healthier in life and as they move forward. Let's talk about their psychological changes. We've all seen this in public. I don't care where you go, what you do. You're going to have that one kid that says, nope, I'm done. I'm shutting down. All the parents are embarrassed and be like, oh my God, I can't believe my kid's acting like this. They all do it. We do it as adults. We have our fits. We throw our temper tantrums. So it's one of those things. Now at birth, they do start to evolve due to their interactions with people. They start to have some different reactions, especially to the environment. They learn their fits because of it gets them things, or when things are taken away, that's where you start to see the demon come out in them. It's the best way to put it. You're going to put some Jesus in them. All right. So crying is their main way to communicate. A baby will cry for anything. I was always told anytime that your baby, infant cries and you can't figure out, you always want to look at their fingers and their toes because they grasp a lot. They hold things super tight. You always want to check their fingers and toes to see if there's any type of hair that has wound around their fingers or toes and it's cutting some of the circulation off. So that's one of the things I will always tell, like especially in our CPR first aid classes, to if you can't figure this out, let's start at 0. Let's touch their little toes. Put your hands on them. Put your hands on their fingers. What's going on? Check their core. Check everything like that. Rob, we have another one trying to get back in a different class. So parents can often tell what is wrong just by the tone of their crying. We can do that as parents anyway when we talk to our children. Some of the things that they say, we know their tone creates a lot. Same thing with adults. We deal a lot with our Hispanics that come out here and work with us. I'm very far from understanding Spanish. I'm learning more as I work with them. But one thing I've learned over time is their tone changes with their pain. You will hear them talk a lot louder because they're in pain instead of being able to translate that. Our translators that work with us work amazing. I stand behind. I love all of our guys out here. They're a great knit family. I may not understand what they're saying, but they're good dudes. Someone says, my 2-year-old is on the floor kicking. Hey, look, so now you're living right through it. We know, Riola, that you were dealing with it and you handle it your way. You see Rob's message for the ones that can't. Rob said, since I'm here tonight, I'll be hanging out in the chat. If y'all need any questions or anything on the sidebar, y'all message him. He will answer those through the chat. If you need me, please to pause from the lecture and answer something in the end. Something is on the end, raise your hand. I will get to you. Correct. All right, so next slide. I'm trying to watch the clock because I'm very big on the hour, but my butt can only take so much too. All right, so let's talk about some more physiological changes. So one key to having a happy baby is spending time with that child. They grow off the interaction that you have. They learn their demeanors, their moments, their motions, their moves. They learn all that from you. So the more time we spend with them, the more we're able to teach them and grow with them. That is a bonding part. We have the formation of a close personal relationship. That's their bonding with. It's just like an animal. The more you want them to be attached to a person, you got to have them spend time with that person. Secure and attachment occurs when an infant understands that parents and or caregivers will always be there responsive to his or her needs. That's the only way we can teach them. We know that I'm the one that's going to give them their care. I'm going to love them. I'm going to help them. I'm going to change them. Those kids learn that I can put trust into them. I have a lot of faith in this particular person. So that's why that spending that is there. Let's see what is here. Separation anxiety is common in older infants. I use like dropping them off at childcare. Sometimes your kids will want to go super fast. They're out the door, and you're like, "My baby's leaving me." But then the next day, it is like trying to get a spider monkey off of you. They don't want to get off of you. They don't want to leave. So understanding that separation anxiety does get there the older they get. You may start to notice that in some infants also, their clinginess, uh, they get real fearful of some places and people that they don't know, that they haven't met before. Infants do become accustomed to their homes and families. I call them the insiders. They don't like to be out. They begin to need that security of everything is predictable within their home. They are used to that security, so they create that tight knit. Okay, this is home. I can let my guard down. So trust and mistrust refers to some of the stages of development from birth to about 18 months. So in most infants desire that their world be planned, organized, and routine. They don't have to do anything. They don't know what's going on, but everything's good. I can go from there. Sometimes, hold on. When their caregivers provide this, it helps them gain that trust in those people. They know, hey, they're going to feed me 2, 3 times, 4 times a day. And if I cry, I might get something else. So we have to think about that when we're dealing with these children. If an infant does not perceive in its environment as secure, a sense of mistrust will develop. Most of the time, if you go into a home and you reach out to try to hold that baby or grab them to do an assessment of them, they're not going to come to you. But if that child does come to you, you have to think this is not normal. Why is this child willing to come to me as an anxious person, as a stranger? Why are they not having that fear of me trying to provide care for them? So keep that in the back of your mind. Later chapters will go into more depth on that and why that occurs. Okay, so now your toddlers and preschoolers. So your toddlers are now starting from 1 to 3, and then our preschoolers go from 3 years to 6 years. You'll start to see that physical change. You'll notice that again, they start to have some vital sign changes. Their vital signs will change from 80 to about 140. Their respiratory rate starts to decrease a little bit. We now go into our 22 to 37. Their systolic blood pressure normal range is anywhere between 86 to 106 on their systolic level. Now we change our temperature is about the same. We're going to stay in that same range from 96.8 to 99.6. And then usually about our preschoolers, we're going to get anywhere about a 98.6. That's going to be average for our preschoolers. So now these toddlers, the toddler's lungs are still continually to develop. They start to get those bronchioles that are more defined. You start to get the alveoli. You start to see more. You won't hope to God you don't see it, but you will. I use the word see a lot. You'll be able to see when they have those the branches of the bronchioles, and then the alveoli starts to form the little circles off of the bronchioles. So that is more adamant into those ages, and they start to will branch out and grow the more developed that they come. So our preschoolers are anywhere between 3 to 6. You notice that your pulse rate now is 65 to 120 beats a minute. You will see that their respiratory rate is from 20 to 28. We're not going to say that it's not going to go higher. If the kids get scared, their respiratory rate is going to increase. they've been outside playing. They may increase a little bit, but their normal range is 20 to 28. You'll notice a big difference in their systolic blood pressure now. It's going from 89 to 112. That's going to be normal. And at this age, you will start to see their weight start to just level off. They may stay super small for a little while. They'll put on some weight the older they get, but they don't have that big increase as they did. They're not gaining an ounce a day like our infants did. You will see their weights just start to just coast, to just plat out. Although toddlers and preschoolers have more lung tissues, they do have a well-developed lung vasculature. So their lungs are very deformed. We know that now they start to have well-developed bronchioles in their alveoli. You will see that is probably the age where their lungs start becoming the strongest. And then obviously the older we get, ours come down a little bit. But that is when they're in their prime, their lungs, yeah, that's going to get bigger and all that, but they're respiratory wise, they're in their prime states. So let's see here. All right, let's go. Okay, so the loss of some passive immunity it starts to occur at this age. We'll see some viral infections or their colds. They start to develop, and they will manifest as some stomach problems. That will be our gastrointestinal distress. We'll notice that they start having anywhere but difference between a solid and a liquid stool. It may be a while for that because they're more active. They're going and coming. They're eating different foods if they're going to school. You see here our toddlers are up running around more, so their gastrointestinal system is more active, and it's trying to figure out, oh, well, how do I keep up with this? A lot of your URIs or your upper respiratory infections will be more common in this age. I can't remember I can't remember a time when my daughter, she's the youngest, actually did not have snot coming out of her nose at this age. It was always, no matter where we went, somebody had a pack of tissues on them because she was snot faced. That's 110% all the time. Our neuromuscular growth at this age makes a huge leap and it starts growing at this age. So our toddlers and preschoolers spend a lot of time finding out what does what, the who, what, when, where, and whys on running, jumping, they're playing, they're figuring out their bodies and figuring out what we enjoy in life. So being able to do these things makes them happy. So you will start to see them, oh, well, I see these blocks or I see this riding toy. Those are fun. So you start to see their brains grow a whole lot more. By the end of this stage, our preschoolers will have a brain weight of 90% of its final adult brain weight. So their heads are going to be big. When they're learning to walk, their heads are bigger and the heaviest thing on them. So that's why they fall a lot, because they're trying to balance this big old melon that they have. You'll see them they'll get up and they'll just kind of be dizzy. Well, they may be dizzy, but they're trying to gain their balance because their heads are big and they can't figure out how their neck muscles are not working the best way. Playing places do put stress on their muscles and bones. That does help increase their muscle mass and their bone density. So them playing on different objects of the house, the stool versus the couch, trying to get up in a chair, all that is adding more stress to them, but it's building those needed muscles as they grow out through life. We have some continued growth in their renal system. You'll start to see the elimination of certain patterns on that renal system. When we get to a certain point, this is where we're working on your potty training versus getting away from diapers. So they're learning how to hold it and letting you sometimes know when they have to go, or they unfortunately just go, and you're like, "Did you poop your pants?" And they're just like, "I mean, no." So that's at the time when their body's learning that. Physiologically, toddlers do have the neuromuscular control, and they're about the age of 12 to 15 months of old. They start to have that ability to be like, whoo, they can hone in and they control majority of the time the their bladder. Well, I just went to soft space there. So a child may not be physically or psychological ready until they're 18 to 30 months old. They may just be, they're not slow by no means, as in growth wise, they're just, those particular muscles have not got into the honing zone and figuring those things out. Most of the time, your completion of toilet training to where you can be 100% is about the 2 year range. 24 to 28 to 30 months is kind of your time to where they can go at all the time. If they say I'm going potty, you're like, oh, I better go with you. All right, you're good to go. You will start to see them start having teeth in this age range. This is where you're going to have them cry a lot because they're breaking the skin of their gums. You will start to notice some pain. They can grow, they can have a low grade fever during all this. They have these, I know they barely started breaking them when my daughter was there, but it's these little bitty dissolvable pills you can put in their mouth and it will help numb their gums. I can't remember what they're called to save my life, but those are great when they're teething. They do drool a lot, just FYI, so you be ready for that.
Oral gel. It's called oral gel.
Yeah, I know Orgel, and Orgel is great because sometimes it can be funny too. Um, so the worst part is most of the time the leading let's say the cause of death in this age group is just their unintentional injuries. They have a zero fear at this age. They don't know what can and can't hurt them. So literally they walk off the edge of the counter or they climbed up on the counter and they just walk off. Oh well, that's fine. You know what? They fall off the couch, they hit their head. That is one of those leading causes of death, is just plain accidents. Having those accidents is unfortunate, but we do have that a lot in this age group. I'm going to finish this slide right here and we'll take a break. So our toddlers, our preschoolers, they continue to learn. They start speaking. They have their way of expressing themselves. You hear a lot of grunting in their young age, and then they're finally learning how to say physical words or words that they can try to mimic. Like my daughter she used to call them no nuts instead of donuts because she couldn't say a D. I know that's kind of funny. We still call them that, and she's 10 now. So, however, toddlers are very attached to their parents. They do feel safe with them. That's why I was saying if you have a child that comes to you and that's not scared, that should be a signal to you that something's going on. We talked about separation anxiety. That is at its highest level when they're in the range of 10 to 18 months old. Be aware of that. So at 36 months is their basic age length, is the basic age where they've mastered the language of speech. They've kind of mastered it to enough that they can keep going and carry their conversation on. By the age of 3 or 4, most children can use and understand full sentences. I've always thought, I didn't do it with my child, I wish I would have. At the same age, the same time, that is when it is the easiest time to teach a child to be bilingual. They understand it a lot easier. And then the older we get, we're like, bruh, ain't happening. So I highly encourage, if anybody has children, to start trying to teach them to be bilingual of any language that you may speak. They go from using language to communicate to what they need. Using the language that's creativity. And they're playful. They communicate with their friends in different ways. So they're trying to they may not understand that as like a Tonka truck. They may just call that a big truck. So they understand that they're more playful in their age. Interactions and playing games with older children starts to begin at this age. They teaches control, following rules, and competitiveness at this age where, I guess we're at the point to where everybody gets a trophy. They start to understand the pros and cons of winning and losing. By the age of 18 to 24 months old, our toddlers do start to begin and understand the cause and effect methods. You do this, this causes that. You do this, this may award you with something. Children also start to learn and recognize some sexual differences by observing their role models, like a mother and a father. They understand that that's the love. They see the love and care. You kiss them, the kids learn how to kiss. The different things like mama does this or daddy does that. Those things they pick up on their parents. They learn roles, how to do different things like I've always had this, like with my little girl, I could never take her to the restroom until she was able to do it all by herself. I couldn't do it. Just mentally, it was one of those. It was like I can hold your brains, but I can't help my daughter go to the restroom. I didn't understand that was like a big like, what are you doing, Chris? But they learn those things through they're seeing how their role models do that. So I talked a little bit long. I see it as 7:04. Let's take about a 10-minute break. So at 14 after, we'll come back and pick up where we left off. So see y'all in just a minute. I'm going to pause everything or close my mic and the camera, and I will see y'all in 10 minutes.
Before you all bounce out for the 10 minutes, I did put the Discord link into the chat for those of you that can see it. Almost everybody should be able to. Feel free to join it. This is not a part of the class. This is an attempt to build a community across all of public safety. So you guys are EMS students, but we have people that are in here with as firefighters, private EMS, people just coming in. Get your coworkers and other people in it, law enforcement, corrections, dispatch, you name it. We want to get everybody in. So that we can kind of start to build that community. You guys can network, find new job openings, mentors, you know, make it your own. Use it to decompress. Obviously, keep it PG, but you know, you get out there and you see some stuff in the field and you need to talk about it. This is a great place to do it. Again, this is not part of the class. You don't have to be in it. You don't have to join it. Nothing in there will be class related, at least not directly, but people in there may be able to help you out if you're struggling too. It is new to the point where the new car smell hasn't worn off yet. If some of the automation doesn't work, I apologize. Let me know. But when you get in, you should have a questionnaire that you have to fill out that asks you like, what's your role in public safety? How long you've been in it? And then it tailors the server to you based on what you do or what you want to do. Anyway, just tossing that out there. Y'all enjoy your break.
All right, so let's get it started back off in here. All right, so our school age children. Now our school age is anywhere between 6 to 12. You start to see the physical changes. From our 6 to 12, our school age child's vital signs, our school age 6 to 12-year-olds, their vital signs and body start to gradually approach those observed in some of our adulthoods. So their pulse rate normally goes anywhere between 58 to 118. The respiratory rate is now around 18 to 25, and you start to see that systolic blood pressure go to the normal range and from anywhere from 97 to 120 millimeters of mercury. So obviously some obvious physical traits start to change. Their body function start to be apparent. Most children at this age will start to grow about 4 pounds to and 2.5 inches per year. Their brain activity starts to increase and both sides of the hemispheres. You will see their permanent teeth begin to replace their children's primary teeth. Unintentional injuries are the leading cause of death in this age group. Also, they do things unintentional to cause harm to themselves. Again, as they don't know, we've tried to shelter our children to a certain point as they grow. So trying to show them, hey, look, this can hurt you. We don't really want to do that until it is it's a teaching moment. Maybe they've done something. Now that's when we teach them that certain things can hurt them. You will start to see the psychological changes also. You will start with seeing that critical time in development where children learn various types of reasoning. They will start to negotiate with you. You have that some pre-conventional reasoning where children act mostly pure to avoid some punishment and get exactly what they want. Their conventional reasonings, the children do start to look for approval from their peers in society. That's where they want to be wanted, and they want to be told, "Oh, he's cute and she's pretty." You have that pre-conventional reasoning where children make decisions guided upon their consciousness. They is this right? Well, I don't really feel. You start to have that at this age. Now they start to compare themselves also with adults and peers. Our children will start, excuse me, will begin to develop their self esteem at this point. They feel bad. They start to, well, maybe I'm not pretty. They have all that in there. Their self esteem is how we feel about ourselves and how we fit in with our peers. We want to be friends with such and such, but she says I'm ugly. I hear that all the time from my daughter. And I'm a different parent. And a lot of times I'm like, maybe she's right. Nobody likes you. You ain't got no friends. One is I can only hear it for so long. And I'm just like, well, I'm tired of it. I'm done. And my daughter knows that I'm picking. That's just the way I've done it for so long. She's gotten to the point. She's like, Dad, I know what you're gonna say, but such and such is being mean to me. I was like, well, I'd be mean to you too. You're not nice. Um, I've always said I teach my children the hard way because life is not fair. The older you get, I want you to be prepared. So I have a different way of parenting. I've been told multiple times, but children, okay, they're good. They're not psychopaths yet. So from anywhere from adolescence, you will get to 12 to 18 years old. We'll go off on their vital signs again. They start to level off with our adults. Okay. You will see a pulse rate now is anywhere between 50 to 100. Their respiratory rates go from 12 to 20. And their systolic blood pressure is now between 110 and 131. That's where we said we start to get that level off. They become more reasonable with adults and their vital signs. So in our adolescence, they start to experience a rapid 2 to 3 year growth spurt. They increase in muscle and bone growth. They do start to see these body changes. You will notice things that weren't there last week, or you're like, wow, what the? Growth begins with hands and feet, then along bones and extremities, and then grow up their torso. So they're growing into their body. You will see that some of those things. I 100% agree. It's with you, Rob. I'm sorry. Girls generally finish growing by the age of 16 years, and boys will continue until they're 18. Once they're around the 17 to 18-year-old mark, the height that they are is what they're going to be. They're not going to be growing much taller. That is the point. At that point, that's where they're at. You will see their muscle mass and bone densities. They're about the adult age. They're about the adult level, and it's just going to that's there. Now we talk about the reproductive system. So as you tell that, just again back to Rob's statement. So you have your external sex organs start to enlarge there. You will see their pubic hair and auxiliary hair begins to appear. You notice their voice starts changing in this age. It's fun to pick on them then. And then in girls, you will start to notice their breast and thighs increase in size as the adipose tissue is deposited into those particular areas. I'm not into this with this age group. Their menstruation usually begins during this time. I'm having to deal with that at my house with my baby girl that's 10. I don't handle that well. So that is my wife's job. She has to handle all that. 90% of the time I'm doing majority of the handling. She's a daddy's girl, but I can't do it. I'm done. I'm tapping out. By the middle of adolescence, boys are able to produce sperm, and girls' ovaries start to release eggs for fertilization. You will start to see them having those acne problems. They're producing the testosterone, estrogen. So their body is trying to figure out what levels they're just up and down all the time. So their acne levels will be higher. You have Again, they're staying in the same group for unintentional injuries are also the leading cause of death in this age also. A lot of endocrine system. Rob was putting in there. A lot of the endocrine system wakes up at this point. This is why adults tend to handle shock better than children. Very, very good point. Computer. Now you'll get into some of the more of their psychological changes. Adolescents and their families will often deal with conflict. As adolescents try to gain control of their own lives, they want to make their own decisions and their own independence from their parents. They start to do things more with friends. They want to go here or they want to go there. So that's where you get to those points. Privacy becomes a huge issue at this point. You will start to know them have their self-consciousness levels get higher. And I swear my daughter must be at this age versus in the 10-year-old range because I'm dealing with all of this. Adolescents may struggle to create their own particular identity because they're around all their friends and they want to be their friends, but they don't know how to be themselves. You use some feedback from their families and peers to help create their image that they're looking for. This is what they're trying to be. They go off of who they're around a lot of the times, what they see, what they hear. So that's some of the things. Know what I'm supposed to do. We've got to figure this out. So their body are constantly changing. They're trying to make this decision. They're very rebellious at this age. They're trying to build themselves away from their parents, but they want to come jump in your lap and lay with you and love on you as they are their own. And why are you bothering me? I want my own privacy. Why can't I have my own my own bathroom? Let me just grow all this money that you want, honey. I hear that a lot. So adolescents continue to compare themselves with their peers. They do make their peer pressure a major factor in adolescent psychology growth. Adolescents' behavior peaks during this 8th or 9th grade. Ooh, I got a long time. So this is where they start to have their disorders. They start to, the biggest one I can speak about is like their eating habits. They will start to create their eating disorders in their teenage. They become obsessed with their bodies, what they look like, the image that their body is producing to where how people perceive them. At this age, also, we have to start worrying about some self-destruction behaviors. You may not see some of the smoking that they're doing. They're sneaking behind your back, smoking and drinking, and some of those high risk. At this age, also, you will hear them start talking about self-mutilation because they're not fitting in. They don't have this going on, or this particular friend that they really want to be friends with they're not cooperating. Adolescents may show some greater interest in sexual relationships at this age because they're trying to figure out how to handle their testosterone and estrogen, and that's just something that's it's in the air for them. Then you start to have a big part for code of ethics starts to develop at this age. Is based particularly on some parents' ethics and values and the influence that you see as you teach these children. As they grow up in a very strict home, either they're going to be rebellious to the left and say this is not what I want, or they're going to live this this very strict life. They're going to rebel off to the left and say we're never going to do this again, or they'll either stay on that path, and that's something that they will instict into their children as they grow older. Unfortunately, when we get to this age, this is where we have a lot of high suicidal rates and due to depression, not knowing, trying to figure out who they are, what they are, how they are. I don't know if I'm supposed to be this way, or I don't understand what's going on in my life. So they result to ending their life, and it's a very traumatic event to have to deal through. But you see that a lot in this age group. So early adults, they range from 19 to 40 years old. Whew, that's a big group. So vital signs do not vary greatly from these throughout their childhood or through their adulthood. So they're kind of in that range where they're going to stay. So now you'll get to the point where ideally their heart will stay in around to the 70 beats a minute. Their respiratory rate will be in the range of our normals. They're 12 to 20. And their systolic blood pressure is around 90 to 140. That is normally what's going to stay through their adulthood, unless there's a particular reason what changes their vital signs. They may have an enlarged heart or a hole in their heart is the younger they were. That may affect those changes. Some just things that are growth through life that will affect them in this age group, because 19 to 40, you see a lot of them in those ranges. That's where they're building their career, their college, their own families. The stress of life is into this, which can change all of their sets of vital signs until they start figuring them out, go to the doctor. All right, so from the 19 to 25, their body should be functioning at their prime level. I wish when I hit 40, I was at prime, but I was already on the way down. So lifelong habits and routines developed. I always tell you, I'm the first one. I'll enjoy the party all with you, but bro, it's like 9:15. It's time for me to be home. I'll straight up. I got to be in bed. That's my routine. That's my habit. I'll tell you, if I'm not teaching, most of the time I'm already in bed by 7:30, because 4 a.m. comes very early around here. At home, I ain't getting up at 4. I can promise you that. At the beginning of this period, their body starts to working at their peak efficiency, but in early childhood, early adulthood does continue to wear on their body. Their bones start to have the wearing part. They're on that downhill side. You'll notice you'll start to have their spine will settle in places and positions. Their height, like I said a while ago, will start shrinking on the way down from on the closer to the 40 range. You notice that fatty tissue increases, which leads to weight gain. It's that weight that I just can't shake. They're unable to rid that extra poundage. And then you have that muscle strength starts to go down too. You're like, why can't I lift what I used to when I was in, my primes? It's natural. Ladies aren't able to like, why can't I hold, such and such as baby on that side all the time? I have to sit down and prop up. I get it. We're to that point to where our bodies have changed on the inside, and we're trying to understand why aren't we the same. Unintentional injuries, again, strength, it decreases. The reflexes start to slow down in here. Visual changes affect a lot of that. But unintentional injuries, again, is the highest at this particular age group for death. Some psychosocial changes. Life centers on work, family, and stress. I think that should be backwards, and it should be family, work, and stress. During this period, humans strive to create a place for themselves in the world they live in. And many do everything they can to settle down. They want to start creating them. They want their family. They want their children. So they start to find that point to settle. And as early as adults do, they do struggle to find their that stability in their jobs. They realize what job stress is, on how high that is. You have some that are still trying to figure out what they want to do in life, anywhere in that age range also. Along with that tendency to settle down often becomes marriage and family, that 19 to 40 range. Childbirth is the most common in this age group. This is where our baby producers are. That is where we have our population increase in this age group. Despite of all this stress and change, this is one of the most stable periods of their life that they will go through. Things are good for them. Things are, happening. It's their time. That's their prime again. Generally, a lot of fewer psychological problems are related to their well-being. They kind of have that path that they're going on. They're on it. Unfortunately, sometimes the business takes a downfall and they lose their career, can cause a upset in their life or a drastic change. And they try to figure out how to function. Well, what's happening now? Like, I don't know what to do. When we're in the time of our economy system to where we're going through another depression, not as bad as what we see in history, but if you look at the chart ranges and all that, it's another major depression in life. So they see this is the time that adds more due stress upon them, because they're supporting a family, they're supporting, you know, their wife, their partner, trying to make things function. So you see those self-induced stresses increase in this age group too. Now we'll talk about the middle adults. It's a great age range. So vital signs remain the same. They start there. This is where they'll also learn that they may have, early cardiac issues, blood pressure problems, visual sights are going to decrease and can't find it. Their average pulse range remains 70 beats a minute. Their respiratory rate does continue at a rate of 12 to 20. Their systolic blood pressure remains between 90 and 140 millimeters of mercury. The body still functions at a very high level, but the middle aged adults are very vulnerable to vision and hearing loss with other varying degrees of degradation. I'll tell you straight up, I have the worst time seeing right now, and I'm constantly having to I've got a new pair of glasses that I should be wearing. You talk to me on my left side, I might as well just not be talking to me. But that has been there for quite a while due to some things in my past. I've seen that a lot here, and it's one of those you're like, man, this age sucks. But I've had a wonderful time getting here, so it's great. Now, same issues, your cardiovascular health starts to become an issue in people. We've neglected it for a long time because things have been good, we're functioning, but we don't pay a lot of attention to what has caused the some issues on their heart. We may start to notice like A1C levels. You start to notice you'll get into late development of diabetes because that weight gain that you've had that you just don't get rid of, that you've just continued over and over, and you're like, man, I need to get back in the gym. I guarantee you go to the gym every day now, you're going to have 100 new people, and then come February, it's like 110 people have now left the gym. So you start to see your age range for middle adults. They will start to be more active in the gym. They're getting back healthier. They're trying to realize that they have these issues and they want to be healthier. Now, in this age range also, cancer incidents do increase. Many show some symptoms of diabetes and hypertension, like I said. Menopause starts to take place in the late 40s or early 50s. We talked about exercise and health. Diet can diminish in many of the effects of aging. I've always joked and said I don't believe with that. I think that has changed because I think they're starting to understand that they're being told over and over and over that you need to get healthy. You need to get rid of your diabetes and all that. They got to do things where they realize they can't go back, but they can help going forward. So it's time for them to get better. So seeing them in this age range, you start to see more of your 40s, 50s, and 60s going over, that they get healthier. Now in this age range, you have the leading cause of death of people aged from 41 to 44 is those unintentionals. Now, for our age groups of 40 to 60, the leading cause of death is cancer. Do believe that drastically. Everything these days are often causing cancer. It doesn't matter what you do, but some of those things tend to make it. Everybody, I'm sure you drink water one day is going to be bad for your health. All right, so now we start focusing on our life goals. What do I want going forward? How do I want to spend my retirement? What do I want to do? Your middle-aged adults, most readjust their lives as the children start to leave home. They get that empty nest syndrome. The finances become a worrisome issue. How am I going to make this happen? How am I going to make ends meet now as I'm getting ready to retire? What's coming up? I'm I've always said in my age group too now, and especially my oldest, don't plan on Social Security, and, Medicaid, Medicare. That don't plan on you getting that. You need to make those well investments as you're younger when you have more money for you to get older and realize that, hey, I'm good. I saw a thing today that there was this particular person running for presidency, and the statement was made that they are going to start pushing for healthier individuals so they can increase their time in the work field to help out the federal government. And I was like, that's definitely not the way you win presidency there. Because at that age range, things are slower. You start to have more reaction time decreases and more accidents. So you're wanting somebody to stay in the work field longer, and it's like we're not we're not there. Now, so according to the CDC, some unintentional injury or accidents is the leading causing of death for toddlers and preschoolers, school-aged children, adolescents, early adults, and middle-aged from 41 to 44. Now, for 45 to 60, we talked about that as the leading cause of cancer. Heart disease and cancer starts to become the leading cause of death in the ages of 65 and older. Man, we've got so much to look forward to the older we get. It just sounds like I can't wait. I'm closer to those age ranges than I tend to care about. So we have to, like, as a healthcare provider, we need to change that. Like, educate your patients, give them the ability to understand. Hey, I always say all the time, I'm not a preacher, and I'm not trying to tell you how to live your life. But if you quit smoking today, tomorrow you're adding 3 extra days onto your life by clearing up your lungs. It may not be the right statistic, but you're trying to help your patient get better. If they may be a statistic genius, then you might be in trouble. But again, it's not our place to tell the patients how bad they are, but what can we do to help them? What can we do to have the ability to increase their time around? Not a lot of times we see the same sick people over and over, but we do have our frequent flyers. We have our, hey, Mondays and Fridays, Bertha's calling. She's going to want to go to the hospital. And then Fred's mom's calling on Tuesdays and Thursdays because she don't want him at the house anymore. Yes, you do have those, but you unfortunately get to the point to where the elderly are less likely to call and less likely to be taken care of because they get to that mindset to where they don't want to ask others for assistance. They feel like they're bothering you. They feel like they're aggravating your assistance to help them. Some older adults includes people of 61 and older. Now, their physical changes in life, their life expectancy is constantly changing. Longer, shorter, depends on what particular region you live in. Now, approximately 78 years of age is the maximum life expectancy. You're there. It's one of those you're like, man, that's not long for some of the people we know in our families, and that's not what we want. It sucks. It has decreased over time. At the age in which a person will live is based on many factors. We talked about year of birth. That is just facts that we don't have to worry about questioning that one. And then again, which country the person lives in. We know a majority of your Asia continent, they do have some of the healthier individuals. They do live longer. So that is, again, I will go with that one. I'm on page with that particular statement. Heart disease and cancer are the leading cause of our patients from 65 and older. So we talk about their vital signs. Well, we know at this point we can't really put a range on it because, as it states, it says that vital signs depend on their overall health. Are they healthy? Are they anywhere on the range neglected? Their medical condition. Do they happen to have a cardiac problem, or are they neurologically deficient to where they can't get up and move around? So those things take place. And then what medicines they take. And revert this also is their vision is getting to where it has majorly decreased, but are they taking their medicines right? And that's what's causing the medication problem. I'm a huge advocate on looking at patients' medicines. And when you start to see that you have multiple different doctors on there, I always ask them, does your primary care physician know that your cardiologist puts you on this dose of this medicine because your regular doctor has you on a much higher dose? So you're overdosing yourself because they don't communicate. That's one of those things that they refer you to a specialist, but they don't. Majority of your physicians these days don't follow up to see what they put you on, so they're not affecting your overall health, or some particular medical issues created by those medicines. Older adults are often able to overcome numerous medical problems. They also may need multiple medications to do so. And you'll see the more and more you're out there, you may see it if you're already in the field now, that you're getting Fred ready to go to the hospital, and you're like, oh yeah, let me get the orange bag. That's all your medicine. And you're just like, why does this bag have wheels on it? They may be taking multiple medicines a day. And again, that's where I'm like, do these medicines contradict the other ones, or is it too much? That is one of those that it's really good to do in the field education. Once you advance your career and you learn a bunch more of these medicines, and you understand that this one you can't take, this one because it creates cardiac issues. Well, this one you can't take because they're not supposed to take it because it makes them show that uh they get dizzy, and you're like, well, wait, but they all kind of start overlapping, and they just need some education from a good physician or a good pharmacist. Okay, so the cardiovascular system, we know that starts to decline. Oh, sorry. We know that starts to decline. Uh, their cholesterol and their calcium starts to build up inside the walls of their blood vessels. That starts to form that plaque that you hear about. The accumulation of plaque eventually does lead to a partial or complete blockage. You will start to hear some of the older ones and younger ones, depends on how healthy they are, that they're having these open heart surgeries, or they've had a stent put in because of all the buildup, and they feel so much better. And you're like, man, if I'd have just done that when I was 40, well, that's not stopping you from going to a cardiologist and trying to keep a healthy heart. Majority of people older than 65 years of age do have some degree of arteriosclerotic disease, that their heart rate and cardiac output decrease. Their cardiac output can no longer meet their demands of their body. Think about it. They get tired. They stand up too fast. They're going to get dizzy, and they may fall. You may notice a lot of bruises on them. Ask, what happened to you, love? Did you hit something? Well, I fall a lot. And you're gonna be like, by chance, does it happen when you stand up super fast? Well, yeah, it does. Their their body, their heart it's tired, boss. They tired. It slows down its contractility, its contractions, it's the way it pumps, the way it moves, those four chambers, it's slower. So you understand, when they stand up, it can't adjust the blood fast enough for that vascular change of what it's used to doing when they sit a lot. The vascular system becomes stiff. We know that it's kind of, so y'all imagine this. So you have your like rubber hoses, let's say, on your vehicle. Over time, they get, like, your radiator hose will get hot, creates that hot and cold, hot and cold. Well, it does crack eventually. Well, it becomes stiff before it'll crack. So you have to think about that too with your body, is the 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 vessels become stiff. They have a tendency to just fill up. They don't have the ability to have as much blood flow through there because they can't, their heart can't come up with the volume to try to help clean that out. You can't just run a, rotor rooter through the valves and clean them all up in the veins. So their heart must work a lot harder to move the blood effectively. You will notice in this age range too that their diastolic pressure will start to increase. The blood flow to organs is decreased, and we know why, because their heart can't work as hard to get them to those particular vital organs. You see some activity levels will slow down because like I get tired so fast. I don't know what's wrong. I'm getting so tired. That's part of it because of their body's ability. Now, again, their ability to produce replacement blood cells starts to decline, as does the blood volume. Their bone marrow is also replaced with some fatty tissues, so their bones are not as rigid. Prime example, my grandmother, she's 92 years old. Recently spent a stint into the hospital. She's just most of the time she takes one pill a day and it's fish oil. That's all she's ever had to take in her life. She's very, very healthy. But she got dizzy over a time and started was falling in her house. So we were all concerned. Well, one night we found out she went to the hospital by her local area, and she spent a couple of days. Well, she ended up having some blood loss, and they couldn't figure out where. Come to find out, she was having some lower GI issues, and she actually had a tear in her rectum. And what was happening is that we lose blood all the time, every way, but she was having a pooling area, and she was losing blood through her GI system. But she took about 1.5 liters of blood, and they fixed the area. And like talking to her now, she's running. You'd think she's 70 years old, and she's 92 years old. You can't whisper around her. She sure can hear you. Her hearing aids are working great. So we always say, if you're gonna say it, you better say it loud, because you don't whisper around Nanny. She gonna pick up what you say. So you have those in the elderlies. They start to lose that volume, and it's hard for them to get that back. So now we talk about the respiratory system of our older adults. So the size of the airway does increase as a smooth muscle weakens. And the surface area of those alveoli starts to decrease. So alveoli, they don't rebuild like your bronchioles and your why did I just go blank? Anyway, once they get clogged and they turn around and have like a mucus buildup, or they get clogged with smoke, you don't regrow those. They don't just fall off and get washed out through your system. They stay the way that they are. They're blocked. So their respiratory system, they do increase on their respirations because it's harder for them to breathe on a natural part. You have your natural elasticity of the lungs does decrease. Your intercostal muscles are used more to breathe, so that's more of your chest movement. You will start to see that they struggle to breathe. Their chest becomes more rigid due to the calcification of the ribs and the sternum. So it gets more rigid. I mean, it's stiffer. Their chest becomes more fragile, and bone structure weakens over time. It is not uncommon for us to have to do CPR on our older population, and we break ribs or their sternum breaks. That is not uncommon. And the first time it happens, you're like, what was that? Like, what was that noise? It's hard to understand and feel that, but that's part of it that comes in with that age range. See, the changes in respiratory systems are often gradual, and they do go unnoticed until it is very severe and or life-threatening. Within the mouth and nose, there's a gradual loss of mechanism that protects the upper airway. This leads to decrease the ability of clear secretions, as well as a decreased cough and gag reflex. So you will know a lot of times that when they get that, it's hard for them to clear their throat. They don't always cough until you will see it's really hard also for your elderly to cough up phlegm. That's a weakened muscle, and it has trouble. They have to treat those upper respiratory infections with a stronger medicine because they can't clear it out. Let's see here. Aspiration and obstructions become a lot more likely with this age range because of the particular weakness in their muscles. Smooth muscles of the lower airway do weaken with age, as we talked about. Their strong inhalation can make the walls of their airway collapse inward, and it causes some respiratory wheezing. So when they breathe in or out, you'll hear that. It's not that loud, obviously, but you'll hear that wheezing due to the narrowed particular airways. So many result in some low flow rates or air trapping. You will hear that just trapped because they have those bubbles build up. Overall decrease in the metabolic activity of the older body leads to an increased risk of lung infections. By the age of a wonderful 75 years young, the vital capacity may amount to only 50% of their vital capacity as a younger person. So they're only breathing at half of what a 75 versus 16-year-old. And you think, easy way to think about that is they only have the fullness of one lung. Now, you not saying that they only have one lung, but it's you take 50% of each lung, you get one. So it's kind of thinking you're like, wow, no wonder their oxygen levels are low. No wonder they're having trouble breathing all the time, or they can't lay flat. It's hard for them. That is the reason why that is because you have the loss of their respiratory muscles. We know that's getting weaker. That stiffness that we spoke about in their thoracic cage. You have that decreased surface area where it's harder for them to exchange air and get the oxygen in and the carbon dioxide out. Vital signs decrease as a residual volume does increase with age. You have that stagnant air or the I was looking for a particular word. The stagnant air remains in the alveoli, and we start to have issues with the gas exchange at that point. You will see more of acidosis when that air traps in there, and you can't get that the gas exchange completely. Hypercarbia will build up to this point, but the acidosis, excuse me, is the biggest thing that you will see in your elderly adults. Come on, computer. On the endocrine system, why not? Let's go there. So people tend to slow down their physical activity, but they tend not to decrease their food intake. So now we start to have the insulin problems. You will notice that they will drop off. They don't manage it well. So the insulin production does drop off and their metabolism decreases with age. Older adults are more prone to diabetes. Changes in their mental status may be a result of some blood glucose levels. We have that now as adults, as children. You get some changes in that. You may get that person that's cranky. I can tell you when I don't eat or my sugar starts to drop, I become very quiet. I snap a little bit. My wife says a lot, but I get snappy. And you get to that point to where, like, I just need to go to bed. Well, that's not really what I need. I need to eat. I need to maybe I haven't eaten throughout the day, and some of my activities or I just don't eat, and my activities are burning too much of my sugar, so I don't have a lot to go off of. The reproductive system does change to some extent. Men are able to produce sperm long into their 80s, but the rigidity of the usage of it does decrease over time. Women start to have a decrease in the size of their uterus and their vagina at that age. The hormone production of both sexes does start to gradually decrease as they do age. Sexual desire may diminish with age, but does not cease. They still want to, but it's like, meh, I'd rather go to sleep. So those things are there. It's not like I forget about it at 85. It's just I don't know if I can, you know. Will my heart hold up for it? On the renal and gastrointestinal systems, their filtration function does start to decline up to about 50% from the age of 20 to the age of 90. So if the new life expectancy is what 78, we we may not get to the full 20%, but we're gonna lose a lot. Their kidney masses start to decrease 20% over the same time span from 20 to 90. The decreased ability to clear waste from the body does increase there. The decreased ability to conserve fluids when they are needed also does decrease. And changes in their gastric and intestinal function may inhibit a lot of nutritional intake where they're able to get those vitamins and nutrients out of the food. And then that results into some vitamin and mineral deficiencies. A lot of time your elderly, when they don't hydrate as well, you will start to see a potassium issue go on. The reason why anytime that I take care of anybody, no matter if it's here or at home, I always ask, how's your water intake and what color is your urine? A lot of times you can tell if it's a dark yellow to a brownish, that is showing obviously that they're not hydrated well enough, and that now that their body's getting rid of any of the excess that it can, their potassium's out of whack. Your advances, when we go into cardiology, we'll talk about that. You can start to see some potassium pluses or minus due to some of the waves that we will see on the monitor. Sorry, I'm getting thirsty the more I talk. All right. So taste buds. So we know their sensitivity starts to decrease. You actually lose your taste buds change roughly every 7 years. So the older you get, you don't have as many taste buds. The sense of smell can change. That's going to diminish. Their food's going to taste a little different. They may not like the same foods. The flavor is going to be a little off. They may actually add more salt than they need because they can't taste it as much. Obviously, we know that their teeth become an issue at this point in their life. It does make them a little bit more difficult to swallow certain foods. Teeth doesn't, I meant chew their certain foods instead of swallow because of their teeth. Their secretion glands decrease a lot, which reduces the body's ability to complex carbohydrates and break them down because there's not enough of the saliva. Your gastric mobility starts to, will slow with age because of the loss of their intestinal tract. Then those neurons that are in there decrease a lot the older they get. As we know, is that can lead to feeling constipated. They're just full. They're not hungry. That can add in some issues, some GI issues, add into some infections because they're backing up and up. They have a lot of abdominal pains, and you will notice that there's some tenderness there. Blood flow into the mesenteric vessels may drop as much as 50%, decreasing the ability of your intestines to extract nutrients from digested food. Gallstones do become very much increased over time because in this area, and their anal sphincter changes, reducing the elasticity and can produce fecal incontinence. Their sphincters, that's the muscle that keeps everything in or out, specifically out, but it keeps everything in. It's their way of contracting that muscle down there. A lot of times you will start to get to this point in age where they may have to wear those Depends or something to that fact because they can't control their stomach. When they say they can't control it, it's like sometimes I just go. Your sphincters wore out. That's why you're unable to maintain those your bowels. The brain weight may decrease from 10 to 20% by the time of that they are 80. We know that they become very slow to responses. As you see, their motor and sensory neural networks become slower and less responsive. I'm a huge proponent when they get to this point. I think from age 70 plus, you should have to take a driving exam at least every 2 years because of your the way that your nervous system is there, and you're decreasing the ability of your reactions. So their metabolic rate in the older brain does not change, and their oxygen consumption does still remain very consistent. You have the diminished number of brain cells. That may be because of their past, and they burnt them all up as they were young. Just picking. So the interconnections between the brain and the cells continue as people age. Now, providing some redundancy with the brain, that's why they're there. We need to make sure that this is happening. They're not going to have like a stage 1 and stage 2, but you do have some of that redundancy in the brain. The loss of neurons, but not as a loss of knowledge or skill. So they may forget something or forget how to do it, but that comes with age, they still remember how to, cook for themselves and, all that, unless there's a neurological issue. But that's not some of the things that go with that. You will notice at this age, they don't sleep real well. They sleep short periods of time, or they don't sleep at night. I know the older they get, my grandfather specifically said this before he passed. He was scared to go to sleep at night versus the daytime because he didn't want to die at night. He felt alone. So he kind of reversed his pattern several months before passing, that he would stay awake all night, sleep some of the day, but he would be awake anywhere between 16 to 18 hours, and that was common for him. But that was his depression up until his, not depression, but he was decreasing in functionality for his end of life. All right, so the age-related shrinkage creates a void between the brain and their outermost layer of the meninges, which that does provide a lot of room for the brain to move when it is stressed. In an accident, slip, trips, and falls, you can have a lot of damage to the brain as it bounces around. So the peripheral nerve sensations is diminished and is misinterpreted when they get to this point, when they start losing that. So that's where your slow reactions times come. It's because slow reaction times cause longer delays between stimulation and motion. So it's like they see it and then they respond. So that's how you get those accidents, things that happen. We don't have that many slides left, but if y'all will give me about 5 minutes, I gotta go get some more water. My throat is about to dry out and I keep having to pause. So give me just about 5 minutes, y'all. All right, so let's get this finished up. Like I said, we're not too far. I just was about to die. I have something to drink over there. All right, so we talked about sensory changes. We understand that. Most older adults can see and hear well. You start to do have that visual and hearing ability does loss. You will have some that will need those hearing devices or glasses to make things easier, but it improves what they have. Just because they're older, don't assume that they're deaf or blind, and don't be like, hey, my name's Crit. Man, I can hear you fine. So be cautious in that. And they may tell you, hey, I can't hear real well. You're going to have to speak up. That's easier than just assuming, because then that will take it that you're hollering at them, and they get offensive that you think that they may not understand. So their pupillary reaction and ocular movements do become more restricted with age. Their pupils are generally a lot smaller than what we see when we check the eyes of a younger adult versus an elderly. The eye lens diminish their visual acuity and makes the pupil a little sluggish when responding to light. So sometimes it's a little like, ooh, it's bright in here. They have a little bit more sensory to that too. Obviously, we know some visual distortions are very common in this age, and then hearing loss is 4 times more common than vision loss. I guess I'm going to be in the hearing loss issue. I think I'm actually having both problems right now. So psychosocial changes, as we know, the older adult population does continue to grow. We do have the responsibility to accommodate their needs during their last 20 to 40 years. They have lived their life. They deserve. If they want to call 40 times a day, I'm an advocate of that. I will take them to the hospital or take them where they, a facility 40 times a day. I love elderly people. I know sometimes they can get fussy, but I do really deeply enjoy taking care of elderly patients. Increasing number of older adults in the U.S. as a result of the baby boom from the 1940s through the 1960s. We do have that during that time has produced a lot of needs for your assisted living or your nursing homes because of there was so many that was produced in those 20 years. That. Then financial limits, we also know that our elderly live on a very tight income. They have things they can't splurge, or they can't give the same gifts that they've always done for birthdays and Christmas and things like that. According to the U.S. government, 10% of the people aged 65 and older, or roughly 4.5 million people, are below the poverty level. That's sad. It really is. And I know the way our economy is, there's a lot of middle-aged to younger adults that function in that poverty range. Um, you look at the lifestyle that they may have had at their younger age and the things versus now. Yes, we know the economic system has increased. They do have a harder time. They don't eat as much. Then that's sometimes because of financial reasons, and also the same time as they can't pay for those prescriptions. Like I'll speak. I think the first night of class when I was quiet and answering background stuff is when I had the flu. The one pill, not multiple, the one pill I took was $100. I, I can tell you, at 92 years old, my grandmother's financially sound and all that, but she would question, do I need this? Should I buy this? Or should I mean, I've toughed it out before because they plan financially for things that are coming and they just don't know what to do. So they a lot of times will neglect the medications that they have. So older adults are a great amount of wisdom with us, and we need to remind them of their self-worth. You can learn lots of things from elderly adults. You can learn different uh, ways of doing things. I'll tell you one thing that's gone in some of the younger generation is canning of foods, certain types of gardens. My grandfather used to have a garden every time. I hated working the thing, but it taught me a lot that I know how to create and build my own garden. I know how to can food. I'm still trying to learn how to do my own pickles. That's I know it's simple, but it's not simple to me. But those things are gone. Those are some of the like was it cross stitch knitting, um, all those things like that my daughter ain't gonna do that. I can tell you she can be like, not doing it. Well, you buy those in the store and you're like, why is this so expensive? Well, they got somebody in a third world country, they're paying 10 cents an hour to do it, and they're marking it up 1,000%. Um, like I'll say quilts. My mother-in-law made me a phenomenal quilt, but I still have one that my grandfather had when he was a child. You can't make those things. Those are things that's a skill. That's they don't just perish. And those are some tools I'll tell you that we all should learn. Let's see here. So until about the 5 years before death, most late stage adults do retain that very high brain function. Again, at my grandmother at 92 years old, man, her memory is on point. Things she says and does, it is awesome. I love it. One of the most important issues that older adults need to face is mortality. I I've said this due to some recent incidents. I am to the point to where I don't want to pass yet. I don't want to die on my drive home tomorrow. I'm not ready. I want to see some things. But sometimes if that like I have that mentality, if that's the way that my path is taken, then I'm okay with it. I know what's coming. Death is never fun. It is never easy for anybody. But that's one of those things that we can't run from it, but we have to prepare for it. We have to set our children, our family up for success. The major talk to like when my mom was super sick with cancer and right before her passing, we had to have that talk of, do you have a will? Do you have a living will? Do you have power? We had to do all those things in a rushed manner that it actually made my wife and I very centered and kind of, very important to us the older we got or after my mom passed. We had a living will, the final, what would take place in our medical things like that. It was very hard to do, but when they get to the point, you don't want them to have to worry about that and they're at 90 years old. My grandmother has a very detailed one. So sometimes those talks are very hard. We need to have those and have those early, in my personal opinion. Sometimes that's not the easiest. Some of your older adults do feel useless and they do worry that they are putting a burden on their families. That's the reason why you hear that an older family, like a husband and wife, they do the murder suicide. Whomever is the healthiest, they kind of make a pact that you shoot me and shoot yourself. They can't live. They feel that that burden is very big upon them to not put that on their family. Then you will start to see a lot of the isolation and depression because again, they're trying to separate themselves. I look at it again, my thoughts are, so like your pets, the way you may have the dog that lives outside on your 30 acres and they just roam and come back. Well, as we see our pets get to a point to where it's time, they know that that passing is coming on, they start hiding from you. They don't want you to have to burden with their death. It's the same thing that your elderly patients do as they get to that end stage of life. Those are those hard things that we have to focus on, that we have to deal with our families, ourselves, grandparents. And knowing how to deal with that as a provider is not easy either. It can mentally affect you, and that's one of those that we're real big on taking care of self health. I'm a very big advocate on incident debriefings, how to break down. It's okay to put your arm around somebody and cry on their shoulders, or let them cry on your shoulders, or open their mouths up and speak what's bothering them to you. Due to the recent instances happened here, we've had a couple of debriefings, and several folks have come to me, and it's hard to try to listen and understand what they think, because I know as us and providers, we've been in the field for so long, we have that dark sense of humor that we don't. Sometimes it's hard for us not to be like, "All right, you ready to go eat?" I'm sorry, I didn't mean to say that. Let's continue talking. We handle things different, but we all get affected by death. We all get affected by that call. So self-health is very, very important. That is the end of our lecture for this evening. Does anybody have any questions pertaining to the lecture? I do have your code. Rob, are you there?
Yeah, I'm here.
Do we, or I know things have changed and Rob and I has talked, but my memory is small if I don't write it down. We still doing codes for the end of the class and all that?
Yes, however, the live students don't need it because Teams automatically records their roster.
Attendance.
So
Okay.
all you need is just if you're uploading the video, then put it into the title where I used to put the date. Just put the code there. If I'm uploading it, just shoot it to me in a text or an email, and I'll make sure it gets there.
Okay. All right. Handles that. I'll offline with you in a little bit. So again, that's it for tonight. If you don't have any questions or anything like that, you're more than welcome to bow out. It's been a pleasure. I do look forward to seeing y'all again on Wednesday night. The ones that need to stick around or have any questions like that, y'all feel free. I will stop the recording in just a minute. But other than that, I hope y'all have a good and safe evening. And my advanced class, maybe basics, I may see y'all on Wednesday night. But other than that, I hope y'all have a good night. Thank y'all for coming.